Welcome back to NutriMentor. In part 2 of our hypertension series, we will focus on dietary and lifestyle strategies that help manage blood pressure and support overall heart and kidney health. Let's get started. Dietary management plays a very important role in controlling hypertension. A recommended diet is generally low to normal in calories, low in fat, low in sodium, while providing adequate protein to maintain body function. The main objective of diet plan is to lower blood pressure to less than 140 over 90 and to reduce the risk complications. For patients who are overweight or obese, calorie restriction is suggested to help achieve a healthy body weight. Energy requirement can be estimated based on individuals' ideal body weight. For example, sedentary workers may require approximately 20 kilocalories per kg of ideal body weight per day, while moderately active workers may need around 25 kilocalories of ideal body weight per day. This personalized approach ensures sufficient energy for daily activity while supporting weight management and blood pressure control. When it comes to protein intake in hypertension, we need to be careful. Many protein-rich foods, especially processed ones, are also high in sodium, which can raise in blood pressure. In patients with severe hypertension, protein intake may be slightly reduced to help manage sodium load. However, in most other cases, a normal protein intake is recommended to ensure proper nutrition and maintain body function. So the key is to balance adequate protein while avoiding foods that contribute excess sodium. In patients with hypertension, fat intake needs special attention because they are at higher risk of developing atherosclerosis or hardening of arteries. It is advisable to avoid high levels of animal fat and hydrogenated fat, which can worsen cardiovascular risk. Fat intake should generally be planned according to individuals' recommended dietary allowances to ensure balance. An interesting point is the role of omega-3 fatty acids. These healthy fats may help manage hypertension by modifying the balance between vasoconstrictive prostaglandins and vasodilatory prostacyclins, which promotes better blood vessel relaxation and lower blood pressure. Including sources of omega-3 like fish or flax seeds can therefore be beneficial as part of a healthy heart diet. Before we move further, let's quickly understand two important terms which was mentioned in previous slide, prostaglandin and prostacyclin. Prostaglandins are compounds formed from arachidonic acid through cyclooxygenase pathway. They are type of autocoid, which means they act like a local hormone. They are formed rapidly, act in a specific area, and are quickly broken down by enzymes. On other hand, prostacyclin is a special type of prostaglandin. It prevents platelet activation and acts as a powerful vasodilator, helping blood vessels relax. When used as a medication, prostacyclin is known as epoprostenol. Understanding these molecules helps explain how certain fats like omega-3 fatty acid can influence blood pressure. When it comes to carbohydrates in hypertension, complex carbs that are rich in fiber are considered beneficial. These foods not only provide energy, but also helps in weight management and improve insulin sensitivity, which is important for blood pressure control. Good sources include whole grains, legumes, fruits, and vegetables. Simple sugars should generally be limited as they can contribute to obesity and insulin resistance. Sodium intake plays a very important role in development and management of hypertension. When sodium intake is high, it increases intravascular volume, which raises cardiac output and consequently blood pressure. At the cellular level, excess sodium inside cell is exchanged for a calcium, which increases vascular tone and can lead to vascular hypertrophy, contributing to persistent hypertension. Therefore, restricting sodium and maintaining a low sodium potassium ratio in the diet is recommended. According to American Heart Association, Patients with mild hypertension should aim for about 2 grams of sodium per day, while those with moderate hypertension may require 1 gram per day use. Use of low sodium salts substitutes can also be suggested as part of dietary management. An important part of dietary management in hypertension is avoiding food high in sodium. Many processed and packaged food contain added sodium in the form of additives, which can significantly increase blood pressure. Some common examples include MSG, monosodium glutamate or Ajinomoto, baking powder, sodium bicarbonate, sodium benzoate, ketchup, soy sauce, and frozen ready-to-eats. Other sources include biscuits, pickles, jams, cakes, and jellies. Being aware of these foods and limiting their intake is key to controlling hypertension effectively. Potassium and calcium are two important minerals in dietary management of hypertension. The daily requirement of potassium is about 3,500 milligram, including plenty of fruits and vegetables in the diet helps meet this requirement and also aid in lowering blood pressure. Calcium also plays a crucial role. Studies suggest that higher calcium intake is associated with lower incidence of hypertension. Good sources of calcium include dairy products, leafy vegetables, fortified foods. Together, maintaining adequate potassium and calcium intake along with sodium restriction forms the cornerstone of a blood pressure friendly diet. Sodium plays a major role in blood pressure regulation. High sodium intake increases blood volume and cardiac output, raising blood pressure. At the cellular level, excess sodium increases intracellular calcium, which increases vascular tone. Therefore, restricting sodium is a key part of managing hypertension. Low sodium salt, including potassium enriched substitutes, can also help reduce sodium intake. However, there is an important caution. This potassium salt should not be used in patients with kidney diseases because their kidney may not be able to remove excess potassium. High potassium in the blood can be dangerous and may cause heart rhythm problems. Finally, lifestyle measures are key. Moderate exercise for at least 30 minutes daily and maintaining a healthy weight support overall blood pressure control. One of the most effective dietary strategies for preventing and managing hypertension is the DASH diet, which stands for Dietary Approaches to Stop Hypertension. This diet has been shown to lower blood pressure and improve overall cardiovascular health. Successfully following the DASH diet required some behavioral changes in eating habits. It emphasizes consuming twice the usual servings of fruits, vegetables, and dairy products while reducing intake of meat and meat products to one third and limiting the snacks and sweets to about one quarter of the usual intake. In short, DASH diet promotes more plant-based foods, low-fat dairy, and reduced processed and sugary foods, which together help control blood pressure effectively. Here on this slide, you are seeing my plate model recommended by ICMR-NI, National Institute of Nutrition, which is a simple guide for planning balanced meal. Half of the plate should consist of fruits and vegetables, which provide fiber, potassium, and other essential nutrients that helps in controlling blood pressure. About one quarter of the plate should be whole grain or cereals, providing energy and fiber, while the remaining quarter is for protein-rich foods like pulses, legumes, or lean meats. It's also important to include dairy products in moderation, preferably low-fat, to meet calcium need. This visual guide helps students and patients understand how to combine food in a way that supports heart health and blood pressure control. Following this pattern, along with sodium restriction and other lifestyle measures, forms the basis of hypertension-friendly diet. This table shows the recommended serving of different food groups in that diet, which is designed to help prevent and manage hypertension. For grains, 7 to 8 servings per day are suggested, preferably whole grains for added fiber and better blood pressure control. Vegetables and fruits should be included in about 4 to 5 servings per day, providing potassium, magnesium, and antioxidants that support heart health. For milk or dairy, 2 to 3 servings of low fat options are recommended to meet calcium needs without adding excess saturated fat. Finally, meat and lean protein should be limited to 2 servings or less per day, focusing on lean cuts, poultry, or fish. Following these serving guidelines helps structure a balanced blood pressure friendly diet while keeping meals practical and easy to follow. Now, let us look at the advantages and limitations of following the DASH diet, starting with pros. Adherence to DASH diet may help in managing blood pressure, reducing triglycerides, improving lipid profile, and lowering the risk of myocardial infarction. It also supports weight management and promotes overall heart health. Now, some cons or challenges are preparing dash meal can be time consuming and more expensive compared to regular diet. Increasing the intake of fruits may affect the glycemic response in some individuals and urinary oxalate levels may rise. Also, long-term sodium restriction may be challenging, especially in humid climates where sodium loss through sweat is higher. Despite these limitations, with proper planning, the DASH diet is considered an effective strategy for hypertension management. In summary, hypertension is often a silent condition, but with healthy dietary choices, mineral balance, and lifestyle modification, it can be effectively managed to protect your heart, kidney, and overall health. Stay aware, stay healthy. That's all for this video. Stay tuned for more content like this on nutrition and health, and don't forget to like, share, and subscribe.